All right. Hello, everyone. This is Janice Yee, Development Manager at the California Budget and Policy Center. I'd like to welcome you all today. We have 500 people registered for this webinar, so welcome all. Again, thank you for joining us for understanding how the state budget process relates to the policy bill process. This webinar is part of our Policy Perspective Speaker Series, a year-round free event series that includes webinars and in-person events throughout the state. Policy Perspectives would not be possible without the support of our sponsors for 2019, First 5 LA and the Stupsky Foundation. And that brings us to our guest today. Joining the Budget Center's Director of Research, Scott Graves, will be Jessica Barlow, Policy Advocate from the Western Center on Law and Poverty, Ron E. Coleman, Director of Policy and Legislative Advocacy from Health Access California, and Tia Orr, Director of Government Relations for SEIU California. So thank you all. Scott will be leading off this webinar by providing a brief description of the budget and policy bill processes and highlighting key factors that help determine whether proposals move through the legislature on the policy bill track or the budget track, or sometimes both. This presentation is based on our guide that you will find under handouts in the GoToWebinar panel on your right side. Then Scott will hand things over to our esteemed guests. After their presentations, you can send us your questions in the questions panel of GoToWebinar, or you can tweet us using hashtag #PolicyPerspectives. With that, I will turn things over to Scott.
Thank you, Janice, and thank you to my co-presenters today, Jess, Ron, and Tia. So what I want to do first this morning is hit the highlights of the policy bill process and the state budget process so that we're all on the same page. And with most things in life, there's a complicated version and a simple version. So given that I only have a few minutes this morning, I think I'm going to give you the simple version, but first I'll show you the complicated version. So this is a relatively complex illustration that shows the life cycle of legislation or policy bills as they move through the state legislature. I believe this was produced by the California State Assembly. This is not a Budget Center infographic. I put it here only to show you that the moving bills through the policy bill process and the legislature can be a relatively complex endeavor, but there are key things to keep in mind, and that's one of the goals of this webinar, to help you all understand how to do that. So the simplified version of the policy bill process, and I think many of you who grew up watching cartoons on Saturday morning in the 1970s and 80s probably recognize these two guys from Schoolhouse Rock. They're going to be my graphic to illustrate the policy bill process throughout this presentation. So this is simply the process where a member of the legislature, either in the Assembly or the Senate, introduces a bill in the first house. That bill is reviewed and usually amended by policy committees and fiscal committees, which are known as appropriations committees in our state legislature, one in each house. If a bill survives the committee process, it goes to the floor of each house. For example, the first house, it's usually going to be a simple majority vote, meaning 41 votes in the Assembly, 21 votes in the state Senate. If it clears that threshold, then you start all over again. The bill moves to the second house. It's reviewed by that house's policy and fiscal committees. There's a floor vote in the second house. And if it survives all of those obstacles, then it goes to the governor, who can either let it become law or veto it. If he signs it into law, most policy bills are going to take effect on January 1st of the following calendar year. So turning to the state budget process, this is the Budget Center's infographic that lays out the state budget process on a single sheet of paper. Again, not intended for you to read here. Obviously, the font's very small. I just wanted to point out that we've made an attempt to take something relatively complicated and make it understandable. But for the purpose of my presentation today, I'm going to give you the simplified version of our state budget process, which really starts with the governor's administration. The Department of Finance and other departments and agencies spend months developing the governor's budget proposal that's due by January 10th of each year. The Assembly and Senate budget committees, starting in the late winter and into the spring, review the governor's proposals, his January 10th proposals, and then review or develop their own versions of the state budget as that moves through the process. They'll typically hold dozens of hearings in each house. Toward the end of this sort of transparent process, leading into May and June, the governor and state lawmakers together determine the funding priorities for our state for the upcoming fiscal year that starts each July 1st. Once they've cut a deal, the Assembly and Senate then vote on all of the bills in the budget package. That includes the budget bill and so-called trailer bills that implement changes to state law that are assumed in the state budget. And those bills are usually going to be passed on the floor by a simple majority vote as well. They then go to the governor, and typically they will be signed into law because generally they're part of a deal that the legislature has cut with the governor. And generally those bills will take effect on July 1st, as opposed to policy bills, which, as I mentioned, take effect on January 1st of the following calendar year. So we've got two processes, policy bill and budget. A key factor that helps to determine the path of a policy idea through the legislature is its cost. Now, we have to think about a proposal's cost because in many cases, policy ideas, unfortunately, are not free. Instead, in order to move from concept to reality, proposals to change state policy will often need state funding. Now, sometimes that will be a small amount of money, and other times it's going to be a relatively large amount of money. So if we start with relatively inexpensive proposals, and I'll get to a little later on what I mean by relatively inexpensive, but if we start with relatively inexpensive proposals, we can see that they can move either through the state budget process or they can move as a standalone policy bill outside of the state budget process. Just a couple key points about standalone policy bills that would increase state costs yet move outside of the budget process. These bills generally do not include funding, which is also known as an appropriation. This is because adding dollars to a policy bill would typically increase the vote threshold that would be needed to approve the bill. It would go up from a simple majority to a 2/3 vote in many cases, and that would make the bill harder to pass. So instead, the cost of a policy bill is usually going to be funded through a future state budget or simply absorbed into the existing budget of a state department or agency. So I don't have enough time to get into that. That is explained in our full guide, and I'm also happy to dive a little bit more into those concepts during Q&A if anybody would like to. If we switch to relatively costly proposals, these will typically move through the budget process. Again, these would be proposals that are sort of considered on the expensive side. However, an expensive proposal could benefit from first moving either simultaneously or initially as a policy bill with the goal of shifting that proposal to the budget track, the ultimate location being the state budget process. So then, naturally the question comes up, well, who's determining if a proposal is expensive? So far, I've been really vague. I've just been using words like relatively expensive and more expensive or relatively costly. In most cases, it's really the governor who's playing the key role in deciding if a proposal is costly or not. Governors are typically applying their own unique rule of thumb in assessing whether a proposal costs so much that they think it should move through the budget process. Now, keep in mind, and for the most part, none of this is written down. This isn't in the state constitution. It's not in state law. That's why I'm calling it a rule of thumb here. But really, it's a fuzzy line. And the line that's dividing inexpensive policy ideas from costly ones is going to vary from governor to governor and probably is not going to be applied consistently by any particular governor. Now, Governor Newsom's only been in office a couple months. At least in my view, we don't know what his rule of thumb is yet because we haven't gone through one full budget process with Governor Newsom leading the way there. So some of my co-presenters may have some of their own ideas about that. But we do know what Governor Brown's rule of thumb was and for deciding which proposals were costly. Again, Governor Brown completed his final term as governor just a couple months ago. Generally, again, none of this is written down and it's fuzzy, but we could see as he was signing and vetoing bills, it was any proposal that would have resulted in a state cost of hundreds of thousands of dollars or more, generally was going to have to move through the budget process. Now, I wanted to give you a quote from a bill he did sign back in 2017, Assembly Bill 80, that ironically did substantially increase state costs annually going forward. But he did say, he kind of acknowledged that he was signing a bill that he typically wouldn't sign. And he said, I caution against using legislation or policy bills to enact new or expanded benefits. Negotiations on spending proposals belong in the annual budget process. So that was sort of the yardstick that Governor Brown was typically applying to policy ideas that were moving through the legislature each year. Now, regardless of how a governor actually chooses to define a costly policy idea, requiring costly proposals to move through the budget process means that many proposed policy changes have to be examined in the context of the entire state budget. They're sort of all going into the same pot in May and June as the governor and legislative leaders are trying to lock down the budget for the upcoming fiscal year. What this does is ensure that proposals with a major fiscal impact have to be weighed against other state funding priorities rather than being considered in isolation. So one way to think about this is that by requiring relatively costly proposals to go through the budget process, a governor is likely increasing his leverage in the process because he's requiring the state legislature to make trade-offs in terms of what ideas can move through the process at any given time, rather than being pinged with hundreds of individual bills at the end of the policy bill process, which is typically happening in August or September, with a lot of decisions having to be made in isolation. One quick point here before I move to Jess is really the critical importance of effective advocacy, meaning smart and persistent advocacy. Mainly because whatever route your proposal would take through the legislature, whether you're going through the policy bill process or the budget process, you're still going to need the support of a majority of lawmakers and also the governor's support. So this means that effective advocacy and education can help to build support for your policy idea and lay the groundwork for success when the political, policy, and fiscal conditions are right. So with that, I want to conclude and hand it over to one of California's smartest and most persistent advocates, Jess Bartholow of Western Center.
Hi, everybody. Can you hear me okay?
Yes.
Okay, great. Hi, I'm Jess Bartholow. I'm with the Western Center on Law and Poverty. I'm going to try to adjust my sitting here so I can be in the middle. Oh, there we go. Okay. So thank you for having us on the call today and the webinar today. I want to say that, you know, this is the practice of working together with budget and legislative advocacy is something that we've been doing in practice for a while, but without really having a conversation of what that looks like, or when do you decide, or how did it look, you know, for you, and so just getting ready for this webinar, the conversations with Ron and Tia, the other presenters here today, was a really great conversation to have, and I really appreciate the opportunity to have it. I've been a legislative advocate here at the Western Center on Law and Poverty, going on my 10th legislative year, and just celebrated last month my 20 years of doing anti-poverty work in California. So that's what I'm bringing to the table. The first time that we ever worked on a piece of, I'm going to walk through a couple of examples of hopefully well-known policy victories that you know about, or that most people know about, or you can Google online, so that I don't spend a lot of time talking about the policies themselves, and more about the decision to make something a budget policy play or a policy bill policy play, and how we ended up in either situation. So I'm going to give you 3 examples of when something was a budget bill and when something was a policy bill and how we got there. So the very first time that we kind of ended up in this situation, it was really by accident. It was at the end of a 14-year campaign to end California's lifetime ban on people with prior drug felony convictions from receiving food aid and cash aid, and also their children from receiving child care and other supportive services when they've had a prior drug felony conviction. This was a policy we put in place at the state's option following welfare reform in 1996. And the policy was really devastating. It said to people, hey, we don't care if you're trying to get your life back in order. We don't care if you need these services in order to do so. We don't care if the drug felony happened before your child was born. We'll still deny your child child care. It was really disgusting policy. And we'd been working for years in the grassroots to get a bill introduced every year. Some years we didn't get a bill introduced, but it didn't mean we didn't keep trying. And it was kind of year after year going at it. In 2013, our author, who was Senator Hancock, was also on the Budget Committee in Public Safety. And she was there with other really great allies, including Senator Holly Mitchell. On the Assembly side, in the Budget Committee, we had Dr. Shirley Weber and the Speaker, Mr. Perez. And they saw our bill get caught again in appropriations. And they pulled us in and said, hey, have you thought about making this a budget request? And we had put in letters. We were kind of clumsy still about how to do this. By then I was just new at Western Center. But we basically pulled a bill that we couldn't get passed through the Budget and Policy Committees and the Appropriations Committee, and pulled it into the Budget Committee. And that year we were able to put an end to the disgraceful policy with the repeal of the lifetime ban for people with prior drug felony convictions from getting aid. And in April of 2014, we enacted that new law. I just want to point out that some of the other states like West Virginia and Alaska and Missouri, very conservative states, have actually passed this policy with just a bill, not putting it in their budget, not 14-year campaigns. And so it was the right thing to do, and we're really proud that it happened after many years of advocacy. But it can be done with just a bill, and it has been done in other states that way. The next time, all this experience with that campaign really helped us to inform the next big anti-poverty campaign that hopefully many people are familiar with, and that's the campaign to end the CalWORKs Maximum Family Grant. This very disgraceful, classist, racist, misogynistic policy, anti-child policy, was in place since Governor Pete Wilson, and what it did was denied aid to a child if the child was born into poverty. It said, hey baby, you're bad, you shouldn't have been born into poverty, and it denied the child its portion of aid. And all kinds of bad things happened as a consequence of this policy, and it was in place for almost 2 decades. So we knew from the beginning that we were going to have to, because by then Governor Brown had kind of articulated his vision for when a bill should be a bill and when it should be a budget issue. And so we knew that we were going to have to make it a budget issue. But we also knew that there was a lot of narrative change that had to happen. This state had never had a conversation about the welfare queen myth and how inaccurate and cruel and racist it was. And so we knew we were going to have to do that. And doing so in a budget context is really difficult. You only get a couple of hearings. It's hard for the grassroots to track. The legislature doesn't, the rest of the legislature really doesn't know how to track big issues and especially narrative change issues that happen in the budget. And neither does the press. So we knew we wanted both a bill and a budget, and we wanted to work with somebody who we knew how to work in both of those spaces. And Senator Holly Mitchell again shows up as a champion, was thrilled to introduce the legislation that she herself had watched since its inception and had been really discouraged by. And so for 4 years, we ran, Senator Mitchell reintroduced the bill. We ran campaigns from the grassroots on that involved impacted parents and reproductive justice advocates, anti-poverty advocates. And what we were able to do within that 4 years is really change the narrative so that people understood why, not only that the policy itself was bad, but how the narrative that allowed the policy to exist was inaccurate and was really intended to be divisive and disenfranchise certain groups of people. So I don't think that would have happened if we had just had a budget campaign the whole time. And I think everybody, as heartbreaking as it was every year to go again and then go again and then pick ourselves up again and go, I think that all of that work was essential. And to the point, on the week after the budget, it finally got passed in the budget. The week after it was passed, the New York Times declared that California, and Senator Mitchell in particular, had finally killed the welfare queen myth. And I think that that's really a credit to the bill budget combo work that was done, and obviously to the leader in that work, Senator Mitchell. Finally, this other, and that's an example, for example, of how we started in both budget and bill. The first example was how we started with a bill and went to the budget. This example is actually the opposite of how we started in the budget and got to a bill. And you heard at the beginning, Scott was talking about Assembly Bill 480 and Governor Brown's statement about Assembly Bill 480 and how he was discouraging that bills expanding programs be passed as bills and not as budget items. But what might not be clear is that this policy change had been discussed as a bill and budget items for several years prior. And this work led by Assemblymember Lorena Gonzalez. She brought the issue of diapers and unmet diaper needs to the Capitol, highlighting the great kind of harm that can happen to a child, to their health, and to their well-being, but also to maternal mental health, with unmet diaper need being the #1 contributor to maternal depression. As you can imagine, not being able to meet your infant's basic needs might be. And she introduced legislation several years in a row, and being discouraged with it being caught up in the Appropriations Committee, she also introduced budget proposals. And when her budget proposal to offer a basic needs allowance, a diaper need allowance for low-income families who receive CalWORKs and have infants or toddlers. When that didn't get through in the budget, she very quick on her feet said, why not require a report? And so she offered what's called a request for an SRL, supplemental report language. And this is an opportunity to kind of ask through the budget that the budget is directing a department or an agency to do some more research and to come up with a report. And so they did that. So throughout the summer, we all spent hot days in the Department of Social Services. They have this big room upstairs where there's lots of windows, and they call it the suite. I think they call it the penthouse. Oh, they call it the penthouse, but it doesn't feel like a penthouse. It's just a big, giant, hot room. And we spent a lot of time there to go through all the various options for how to meet unmet diaper need. And through there, the proposal that kind of got lifted was one that she introduced as a piece of legislation the following year. And so this SRL in a budget 1 year led to a work group. The work group then led to a report. The report then informed the legislative and budget ask. And it was precisely because of that work that she had done in the budget the year before that the governor signed that her bill, AB 480, to create the diaper needs assistance for these families. He said so in his governor's signing statement. He said that the work had been done, and it would be hard not to acknowledge that. So these are the examples of some of the ways in which we've worked budget and bill, and I hope that they're informative and instructive to you in your work and how you think about the Capitol and how we're moving these big policy agendas here, especially as they result to poverty. Thank you.
Thanks, Jess. We're going to go ahead and move on to Ron.
Thank you, Jessica, and thank you to the California Budget and Policy Center as well. I am happy to be here. These were certainly great victories that Jess mentioned. It's also helpful for campaign organizers and legislators to understand how to consider how they design their campaigns when they're going to be moving them forward, and potentially also how to deal with issues once you feel you may actually be encountering a loss. So I do hope to give a few examples as well of how we have decided over the years to move forward with either the legislative process or the budget process, or both, depending on what the political situation has been. I've certainly heavily been engaging in budget advocacy over the last decade. As I'm trying to decide whether or not it's a budget or bill conversation, I have used a number of different strategies, but often it really is based on the political moment and also what the cost or the political ripeness may be of the conversation. Is it a cost to evaluate whether or not it's a smaller ask, maybe it's something that's about $30 million and a smaller breadbasket, or is it something that is a big programmatic change, as Scott had referred to, where it is billions of dollars, potentially upwards of $2 to $3 billion to make something like a major healthcare expansion. I think we also need to look at the political ripeness to determine how the conversation fits into the current state or political national landscape, whether there are needs as it relates to also moving people's hearts and minds, both in the legislature and in the public, or is it an issue where it's something easy to potentially get through and maybe there's broad consensus to where you can get something through a process much quicker. Before I started at Health Access, I did spend a number of years as Government Affairs Director at the California Immigrant Policy Center. We had one situation one time where we had just passed AB 60 in the fall of 2014. At that time, there was language that got jammed in at the very last minute to ensure that the bill could pass, and certainly it was over the objections of advocates, but it would have caused undocumented immigrants to essentially sign an affidavit that contained language that could have been essentially used as proof of them not being lawfully present in the country and been essentially used against them in deportation proceedings. Now, this was during the Obama administration, but there was broad consensus in the legislature among the general members, among leadership, and the governor that they did not necessarily want people to be deported specifically because they had moved forward an application for applying for an AB 60 license. So in this situation, we were trying to figure out how can you move a policy quickly to affect a program that is about to start without necessarily having to go through the full legislative cycle. So we really looked at our options, and the budget process was really the only mechanism that we could use. The driver's license program hadn't necessarily started to roll out yet. The DMV was still ramping up on implementation, so community members weren't necessarily in a place where they could be adversely impacted by the language that had previously been codified in law. So essentially, with the driver's license bill moving forward, that's effective of the first of the year. So any legislative vehicle that you're moving forward is effective at the first of the year unless it's an urgency bill. Essentially, with a budget proposal, you can have both the budget and its trailer bills effective as of July 1st, as we heard from Scott in the previous presentation. So in this situation, it certainly allowed us to make a budgetary play where there wasn't any type of fiscal implication at all, but it was a process that gave us a opportunity to make a quick fix to a program before any community members were adversely impacted, and essentially able to use that process for that fix with an effective date of July 1st before any driver's license applications went out to print from the DMV, and thus we were able to find an exception into the general rule that you need to use the budget policy, the budget cycle on issues that are connected to some type of fiscal component. This was an issue where there was no fiscal component whatsoever, but it's still, given the general consensus, the political ripeness, and the urgency to move a particular policy to fix a program before it went live, we certainly were able to look at the budget as an opportunity to do that. I think the one thing to pay attention to when you are using the budget process for non-fiscal reasons is that it probably needs to be something that is an issue that is small, something that is non-controversial, and something that does require significant urgency, that there's widespread agreement within the legislature leadership and among the governor that policy proposal certainly should move forward. You know, certainly it also could be that it is simple opportunity to be able to move a policy forward based on how the members are setting up in various committees. I also had a bill one time to create the Office of Immigrant Affairs, and this would have been an office very similar to any other agency or office that the governor of California works with. Certainly, that would have costed quite a bit of money. But we were able to, through the leadership of Senator Latta, who was an author of the bill, who introduced the bill earlier in the session, happened to be also on the Senate Budget Committee. So that opened up a mechanism for him to begin doing his own advocacy among folks within the Budget Committee, and then also across the aisle in the Assembly Budget Committee, to ensure that we could potentially have a pared down conversation of the Office of Immigrant Affairs to create essentially a position, a statewide director of immigrant integration, that could meet some of the same demands that advocates saw an office doing. So in that situation, I would advise people to also think about who their author may be of a particular bill, and if there is a particular bill that you are moving where there is a cost and fiscal note to the policy proposal that you're moving forward, but essentially maybe there are opportunities because of that legislator being on a particular committee, specifically the budget committee, which then provides special opportunities to work with that member and have a plan to move that proposal discreetly or non-discreetly through that particular process. And as just mentioned earlier, even if there is a budget conversation to be had, even introducing a bill alongside of a budget request, either before or after, can also help legislature and advocates to work out important policy questions that may need to be worked out. The policy committee process is certainly one of the few places where those kinds of open questions and policy dialogue can happen, and also create a situation to where certain pressures are put on legislators to also think about how to flip that policy proposal that's moving as a legislative vehicle into the budget. Certainly with Health for All, Health Access started that campaign in partnership with the California Immigrant Policy Center as a legislative fight. We knew that Governor Brown's thoughts about that process, since it was a particularly big proposal, upwards between $2 to $3 billion at that time. We're down to a $2 billion breadbasket now, but I think we knew that we had a pretty significant cost, and we also had a lot to learn. The ACA had just passed in California, or it had just passed at the federal level. It had been implemented in California. Advocates were able to push Governor Brown to expand Medi-Cal to all lawfully present individuals, single childless adults, up to 138% of the federal poverty level. But that did not include undocumented immigrants, since they were excluded from benefits under the Affordable Care Act. At that time, we knew there were probably about 1.5 million undocumented immigrants in the state, both children and adults, that didn't have access to health care and that would not have been helped by that expansion under the ACA implementation. We also imagined with a proposal like Health for All that we may be in a politically difficult spot. Governor Brown had to work over his first couple of years to really manage a lot of cuts that had to be made in really bad budget years under Governor Schwarzenegger. And during that time, over $15 billion had to be cut from various health and human services programs. Since that time, and even through today, some of those programs had still not been restored. Many have, but some of those programs, I think for many advocates, we know that they may never come back. But with Health for All, we chose to start with the legislative process to both work out those policy issues, but also some of the political issues that we just didn't know whether or not would come our way. We just didn't want to expand Medi-Cal. We knew that we also wanted to create kind of a mirror proposal to the ACA and also have a way for undocumented immigrants who had higher incomes to also buy into coverage. We didn't know what this would have costed introduction, but we had a really great idea. We didn't know what the political landmines we would face, given past political challenges around immigrants and public benefits, certainly coming out of the Prop 187 years and the sentiment that had been expressed in California around immigrants and public benefits, and really trying to get to a place where groups, generally health groups, anti-poverty groups, also saw advancing issues related to public benefits for immigrants as something that we also needed to make a very strong priority. We knew we could write a proposal that specifically expanded Medi-Cal, but we also didn't know what it could look like to develop a proposal as it related to higher income people. At the time, that was elusive. However, we had a champion that wanted to run a bill. We had Senator Latta, who was interested in the issue. We ran a bill so we could test our messages, test the politics, begin to sort out costs, and we basically had a live policy vehicle moving that community members could also organize around and share their stories and get into conversations with members that particularly sat on the health committee or members that we thought were going to be targets on the floors. To be honest, at that time, we probably didn't even have enough information to develop a cooked budgetary proposal that could move in the quicker, narrower budget cycle, and we needed the longer cycle to vet what we could do, and also really drill down on the opportunities and flush out what we absolutely didn't know. Of course, the first run of the bill failed. We got it through Senate Health, but it did get held in Senate Appropriations, given the significant general fund allocation that would have been needed to cover the entire undocumented population with healthcare. In that early run, this was the first time many people in the Capitol had ever even heard of this issue or even imagined that this would be a conversation that would be moving forward. It's the first time people learned of the very limited access undocumented people had for healthcare. It was the first time the LAF, the LAO, Legislative Analyst Office, the Department of Finance, and other researchers and advocates really sat down to even begin looking at costs related to this population. But it sparked a conversation and it sparked research and it sparked a quest for information that really allowed us to think about different strategies that we could move forward in the future and potentially even be ready for a cooked budget proposal in the future. Following our failed efforts, we immediately came back the next year with a bill again, but began paving the way for opening a conversation in the budget. It was no longer a new issue. Legislators were convinced of the need. Work had already started again with the Department of Finance, the Legislative Analyst Office, researchers, and advocates, and thus we introduced the bill. But we also knew from watching other colleagues' proposals, some that Jessica has mentioned, that Governor Brown saw the budget as the proper place to really move those conversations. So paired with the introduction of that next bill, we also began to push through those conversations within the budgetary channels. From the failed effort, we knew that we would likely not be able to pull in everyone, the whole entire 1.5 million undocumented population, but did want to go through the budget process and legislative process to really assess how can we cover as many people as possible. We even contemplated having a bill that was based on what the governor could fund in the future if the governor ultimately signed a bill. But because of what we were able to do with that second bill that was introduced, and because of what we had learned from the first year, essentially that conversation did get pulled into the budget that particular year and ultimately led to leadership and Governor Brown deciding to move forward Health for All Kids, which did ensure that all kids in California, regardless of immigration status, everybody up to age 19 could access Medi-Cal, regardless of where they were born. Still, after that win, as you can imagine, the coalition was still interested in fighting for the adult population, but the strategy was influenced by both state and national happenings. At that time, Health for All Kids passed, was implemented in 2016, but of course, the coalition still wanted to close the gaps for all adults. At that time, we really had to look at the national environment. Trump had just won in 2016. Republicans had won both houses of Congress, and the ACA was at great risk. So with the ACA at great risk at the federal level, legislators were really concerned about expanding on what we had built with the ACA and expanding on Health for All Kids if essentially the foundation was going to be crumbling because of the threats that were coming from Republicans in Washington. Because of that, certainly health advocates focused solely on saving the ACA, and we essentially did not see any bills emerge that year specifically as it related to Health for All moving forward. However, in the beginning of that legislative session, there were some battles that were won at the federal level, and Speaker Ryan essentially coming out in March of that year basically saying that the ACA was going to be law essentially for the foreseeable future. With those conversations then emerging from DC, state advocates did see a very, very small window to potentially try to build on Health for All Kids. Another political moment that we had that year was that Prop 56 had also just passed in that previous election that brought in Trump. And there was some money on the table to make improvements in Medi-Cal, and some consumer advocates also eyed some of that money to look at potentially making expansions to coverage as well. One of those coverage expansions was looking at Health for All adults. We definitely needed to look at the political moment that we were in the situation coming out of those national fights and state legislators concerned about even the future of the ACA at that time, and not really being a big political appetite to have the all conversation. In that year, we certainly were successful in getting both houses of the legislatures to prioritize health for all young adults, but essentially it did not get adopted because Governor Brown still did not support that effort, concerned about ongoing investments. With that said, fast forwarding to where we are in 2018, or where we were in 2018, certainly bills did move forward on health for all. There was also an issue brought into the conversation around affordability of coverage in covered California, and that was also based on the political moment and political sensitivities. Health Access is a group that does support single payer. That was a conversation that was also moving and emerging in the Capitol at the same time. But though we support single payer and universal health care, we also want to look at what conversations can be moved forward today on the quest towards single payer as it relates to expanding coverage, as it relates to coverage for the undocumented and folks who still can't afford coverage in covered California. So through that, we did develop proposals that then did move as both bills and budget items in 2018 that essentially did put pressure on both the legislature and the administration on how to think about getting towards universal coverage. What we did see was ultimately those conversations that did happen in 2018, particularly around bringing back the young adults conversation. Certainly there was a conversation around healthcare, health for all elders as well, but particularly on the front of the young adults, and also with the affordability bills moving forward, it did create an opening for Governor Newsom to ultimately make the proposals that he did in January of this year, where he himself is looking at proposing the expansion of health for all young adults specifically, and also looking at finding mechanisms for affordability in covered California by reinstating the individual mandate. Certainly, we as advocates have bills and budget proposals this year moving in 2019 in tandem with what Governor Newsom has proposed, and we really do hope to build and win as much as we can, both on getting affordability mechanisms on place and closing the gaps on healthcare for the undocumented this year. So I will, happy to answer questions about that, and turn it over to Tia to talk more about examples of how to decide when to use budget and legislative strategies moving your advocacy campaigns. Thank you.
Hello, everybody, and thank you, Ron, for that presentation. First, I want to just thank the California Budget Project for the opportunity to speak to you guys all today. And secondly, I really want to thank my colleagues, my brother and sister, Ron and Jessica. Jessica and I have stomped through the halls and fought on budget policy and broader social safety net policy for many years through our career, and I have a deep respect for them, so I'm honored to be on such an esteemed panel with them. An interesting topic today, right? How to decipher between budget strategy and legislative strategy. And speaking on behalf of SEIU, the Service Employees International Union, we have a unique standpoint in this, right? We represent 700,000 workers across the state of California. Many of them are public sector workers who are funded by the very topic of this discussion, the state budget. Most of their jobs are funded through the state budget. And of course, the infrastructure that sets up a lot of their, the work that they do through county and state government is funded and dependent a lot on the state budget. Every year, we come together with 17 locals across the state of California, and we get a large number of priorities for them of what they want to achieve for the year. Through that process, we have to make a deciding factor if we move something through the budget, if we move it through legislation. SEIU plays big in politics, so oftentimes we're thinking of ballot initiatives, and another recourse is also through the regulatory process. And today, I know we're going to talk and focus a little bit more on the budget and the legislative process that tends to be where most of our proposals fall into. To give you guys some perspective, this year, for example, we have 25 budget priorities that the union is moving on behalf of 700,000 SEIU members. And we probably have about 20, a little bit more legislative proposals that we're moving on behalf of our members through the legislature. And generally, when we're deciding which way we go and what path is best, we do a deep dive assessment on what the needs of the policy are and what's the best political path for us to achieve that. And there's pros and cons of both paths between the legislature and moving legislation through the legislative process or through the budget process. There's a couple of questions we always ask ourselves, more particular to deciding on a budget path. And I think Ron touched on a number of them. One is there an urgency? Is there something that needs to move quick and fast in order for something to be eradicated or moved through the state of California that cannot wait for the legislative process? Remember, the legislative process allows for urgency to happen, but it requires a 2/3 vote of the legislature to move something on urgency, which for us, speaking on our end, is very difficult for us to achieve at times, which makes something that needs an urgency clause or that has to happen fast more feasible through the budget process. Another question we ask ourselves is cost. Is there an exuberant cost that's attached to the policy that we're trying to move that will make it difficult for now Lorena Gonzalez chairing appropriations and Senator Portantino chairing appropriations for them to approve something that large when they have a flood of bills coming into their committees seeking to have financial support added to it? And the third, I think, and fourth question are the politics. Are they lined up? And have we created the buy-in, I think, of the public and the legislature to be able to do that? Now, there's pros and cons of both scenarios, right? The budget proposal or moving something through the budget generally tells us that logistically, it's probably a little bit easier of a path. And I say that because there's less hearings, right? There's less points of engagement for the opposition to try to threaten or attack the policy that you're trying to move. Another thing is that it also, if it gets approved through the budget subcommittees, gets moved into a larger trailer bill that encompasses a whole large array of policies in that specific industry. It's not like your proposal is going to be targeted specifically with all of the different opponents potentially that you have to attack it for a floor vote. So there is some potential positive movement in a budget policy proposal that isn't as difficult as it is on a legislative proposal, because remember, in the legislature, you have to go through sometimes 2 or 3 committees on each side of the House, right? 2 policy committees, sometimes a fiscal committee, and then you have to get a vote of the floor. And that same process has to happen on the other side. So it does create more paths and opportunities for engagement and for opponents of your proposal to maybe push folks off. However, it does also, and especially important for SEIU, and I know Ron and Jessica in our partnership with their respective organizations, we like to move people on the ground. We like to engage our members and create a drumbeat and fire for people that are pushing a policy on the ground. And at that perspective, it's usually easier or more advantageous in a lot of regards to move things like that through a legislative proposal, because again, there's more points of engagement and more times that we're going to be able to get our members and folks in the community to agree. Now, another thing about moving something through the budget that we found particularly difficult, but it's necessary, is you have to start really early. We've started moving a lot of our budget proposals, again, 25 of them that we have this year, all the way back in October or November of last year. And the reason why we do this is similar to the point that I made about appropriations committees. If you wait for the legislature, even the respective budget committees, to make a decision on contributing a certain fiscal amount to a policy that you want, they have a limited amount of money that they can use on advancing specific policies. Whereas the governor, in his January proposal and in his May revise, has the ability to use a larger amount of money to advance policies that he deems important. So one word of advice that I generally give to all of our lobbyists, and I know that we work aggressively on, is starting very early to make our policy request something that the governor and folks in the administration are also seeking for themselves. So it comes out of that pot and not the smaller 10% pot. And that's just a rough amount that the legislature usually has to pull from for advancing ideas for a number of legislators and a number of organizations that are coming to them. Again, there are about 3 questions that we ask ourselves when we decide on moving a budget proposal: the cost, the urgency, the political mobility, and the will of the legislature. Some examples from SEIU's perspective, and I try to use things that I know many of you hopefully either engaged on or knew about, specifically on the urgency. Folks might remember that the Supreme Court has been coming down pretty tough against unions, specifically in light of the Freedom Foundation, where our ability to collect dues from workers and our ability to represent workers is being challenged every day. The Supreme Court issued a decision 2 years ago to make it very difficult for us to represent workers. California and other states around the nation had to respond with policy proposals that would combat against that attack. That created a big urgency. Similar to what Ron described, it didn't have a fiscal attachment to it. It wasn't a fiscal question of cost. It was a question of urgency and whether or not we at the state of California can issue policies that were going to enable and allow us to protect the very workers that the state of California has prioritized to protect. We were able to get that done through the budget, through an urgency and be able to combat a lot of the threats and attacks that were coming from the Trump administration and the Freedom Foundation to attack our ability to collect union dues. An example of cost and really just moving something through the legislature for purposes of creating the groundswell and the drumbeat is an example of our summer bridge program. For many years, we proposed an item and a legislative proposal to the legislature that would hopefully give some ability for classified workers to gain some revenue during the summer months when they're not working. Unlike teachers, they're not able to spread their income out in 12 months because they don't make enough, and it would create a dynamic where they're making below minimum wage. They also don't play into unemployment insurance, and therefore they're unable to collect unemployment over the summer months, which makes a lot of them have to line up in, food lines and get CalFresh benefits and lined up in social safety net services that our own members working for them to stay afloat for the summer months. We try to bill 4 or 5, maybe 6 times through the legislature, only to fail with criticisms that the cost was too high. The last veto message that we had from Governor Brown was we need to do this in the budget, or at least have a fiscal conversation about how to fund this. We took them up on that offer. We moved an item through the budget, and we were successful in that strategy. I will say, absent the legislative push that we had for 5 or 6 years, and absent that veto message that directed us to do it in the budget, I don't believe we would have ever been successful in a budgetary request. So it leads to the example of either doing both at one time or pushing one through legislation and then ultimately deciding on a budget path or vice versa. And another example, and this is really particular to SEIU, because we represent so many public sector workers that deliver a lot of the services that so many of us care about, we are often playing in the budget conversations either through defensive strategy or offensive strategies. Oftentimes, our brothers and sisters and some of our friends that are even on this call advance policies that make complete sense and are in the right direction for the state of California. But sometimes, and not as often as not, they don't include the infrastructure funding that's necessary to ensure that we have the staff to handle the workforce to make the policy realized and achieved. And so oftentimes we're engaging in policy proposals that are being offered by other organizations and sometimes even us, and trying to convince the legislature through the budget process that there is necessary investments in order for the workload and the workforce to be hired to be able to do the job. A specific example of this is in the Continuum of Care Reform proposal. This is a proposal that came through Child Welfare Services, a great policy that says no child that's taken away from their parent should ever have to go into an institutionalized setting. We should ensure that these youth are raised in family-like settings by people that care for them as we hope that their own family would. In order to do that, we need social workers on the ground. We need investigators to go to homes. We need family support services. We need parenting classes and all the different array of services that have to surround that great policy in order to make it happen. Oftentimes, that's a difficult push for us, and we stay present in those conversations in order for that to ensure that it's achieved, and again, for policies to be successful. The last example that I'll give, and I'll turn it over for people to ask questions because I know that's a big important part of our webinar today, is wage theft. Wage theft is a proposal that we moved through the private sector work of our union. It's a great policy. It makes complete sense to ensure that folks that are working as employers in the private sector are held to the same standards and accountability that we want everybody who's an employer in the state of California to be held to, ensuring that workers are not abused, ensuring that workers are getting paid the appropriate amount and on time is, again, a policy, of course, we wanted to push. What we had to add to that proposal is ensuring that we had the infrastructure under the Department of Labor, under the Department of Industrial Relations for the investigators and the folks that need to be on the ground to identify when these underground economists, these people that are really trying to hide from being public, are abusing different various labor laws. And so for a policy like that, we had to make sure that we forced ourselves into budget discussions. And again, make sure that there was enough staffing to achieve that policy goal and that folks were hired enough to be able to do that job. Of course, the last thing I'll add is under the premise of having county workers and state workers having a very padded and healthy general fund amount is important because it is the funding, again, that secures the workforce and the staffing needed for all of our state, city, and county services to operate. So again, it puts us in a very unique position. I'll end there with my comments, and hopefully there's questions that you guys can ask. Again, in summary, I think the budget path is the right path to go on in some circumstances, but you have to do an assessment to make sure, again, the urgency, the cost, and the public buy-in as well as the political buy-in is achieved in order for that difficult political path to be achieved. Thank you so much. I'll turn it back over to you.
Thank you, Tia. I'm going to invite all the other panelists to go ahead and share their cameras and mics. And as we're setting that up, I just want to acknowledge that I know the webinar is supposed to go till 12, but for as long as our guests are available, we will continue to answer questions as we go through this. Also, just to let you know that if you still do get to the questions and we don't get through all of them, you can always contact us at the Budget Center. We'll be happy to answer your questions, or at least find you someone who will answer your questions. That said, there are a couple things I wanted to highlight that all of our guests had mentioned today. One of them, Jessica, had said, it's a long game, right? She worked 14 years on 2 of these things. So flexibility in choosing which path you go down is very important. Ron had said this, you have to understand the policy and the political landscape when you're assessing which path to go through. So it's very important. And Tia had also mentioned another path, which is the ballot measure path. It's an expensive path, but it is a path that you can also get through things. And also something that I wanted to highlight that Tia had said was the starting early. Scott has this other guide, which is the state budget process guide that we're going to be sharing with the audience through our chat function. And exactly, thank you. So it's another guide specifically on the budget bill process that really shows that the work doesn't start when the bill is proposed in January. It's way before that. It's getting in touch with your advocates. It's getting in touch with the legislature way ahead of the proposed budget. So those are just a couple of things I wanted to highlight as we go into Q&A. And I'm going to start with one that I think everybody wants to know, is that as Newsom has just started and we're getting into how Scott mentioned it, rules of thumb that Governor Brown had been under, and now it's a completely different game. Is there any that you have seen in your conversations starting this year, any insights on what Newsom's preferences, rules of thumb, or anything that has been moving that gives you a better idea on how he's going to move forward as we really start this process this year? Do any of you have any insights?
I mean, I would say that definitely he believes in having a budget that represents children. And so for the first time, we'll see like things happening for low-income kids from the governor's budget. And this is kind of new. It's hard for us to figure out, okay, how do we respond to this? We have never had those kinds of proposals come out of the governor's office in the last administration, so that will be new. And one thing I just do want to point out is just so people don't think that the Governor Brown was always saying that high money dollar issues had to go through the budget, because there were times that there were big dollar bills that went through the legislative process, and those were the times that he wanted those bills to go through. And so I just want to point that out. It's not like he was like, black or white on the issue. He was very, there were tax credits for nuclear bomb planes went through with as much money as we would have needed for our repeal of the maximum family grant bill. And that was really disheartening from the advocate's perspective, that he said no to our bill, but was okay for the bombers. So just to point that out, I do think that we will see a lot happening in the budget again under Governor Newsom, though.
I mean, the only thing that I'll add to piggyback on what Jess said, I think we've gotten a pretty clear indication from the governor already, just based on his January proposal, how much he is relying on the budget as a way to move very progressive items. And it's a little bit different than what we've seen of Governor Brown. I think Jessica alluded to it. We're often, in the Governor Brown days, we were putting big policy proposals forward that were advantageous and progressive for the values that we want to protect. In the Newsom short time that he's been here, we're responding to big progressive proposals that he already had in his January budget. I think it's a better place for us to be in, but I do take that in an early indication that maybe there's some willingness to move big policies through the budget path different than a lot of the sentiments that we got from the Brown administration. But that's just an initial gut reaction for me.
And I think my quick thoughts on this, certainly we're really excited about how much Governor Newsom has invested in healthcare. I mean, certainly Governor Brown, I think, saw it as a bottomless pit of how he needed to invest dollars and didn't necessarily see a lot of the benefits. But I think, as you heard from Jessica and Tia, I mean, Governor Newsom really is looking at these proposals as they impact real people and how they impact their lives, how they impact their families, how they impact raising these families out of poverty. So I think for us, we do have proposals that are on very similar tracks to what Governor Newsom has proposed, both on the front of health for all as it relates to young adults, but also affordability. Just have more of a broader and expansive proposal coming from the advocates that we hope to continue to move forward in this law.
Thank you. You heard it from the experts here. I have a question, Scott, on one of your earlier slides. When you're talking about adding funding to a policy bill, you said it could trigger a 2/3 vote. Can you explain what triggers exactly that 2/3 vote? And also, who determines if it gets funded by the budget or through the main budget or through the department's budget? Like the distinction between the two, is that when does that happen? Who's in charge of that process? Sort of that decision that gets made.
Hi, sorry, I had to unmute myself. Yeah, so I think on that last point, that might be picking up on a point I made about policy bills with costs that will move through all the way through the process and be signed by the governor. In some cases, if the dollar amounts are small enough, the governor or the Department of Finance or the administration generally may agree, hey, we can just absorb this, Department X. You don't need a new appropriation going forward. You have enough money sitting around in your department budget that you can just absorb it within the existing resources that you have now in your budget. And those would be typically cases where the dollar amounts would be pretty small, I would say. Janice, what was the first point again? First question?
What would trigger the 2/3 vote?
Oh, thank you. Yeah. So if a general fund appropriation is added to a policy bill, that requires a 2/3 vote to pass it out of each house of the legislature, unless it's for public schools. So, but you won't often find a bill moving through the legislature with lots of money that addresses public schools. That's generally going to go through the budget process. So in most cases, dollars that are being added into policy bills in certain circumstances are going to be general fund dollars, and that's going to trigger a 2/3 vote requirement in each house. Now, my understanding has been that special fund dollars, California has about $50 billion that's sitting in 500 plus special funds. If a bill proposes to fund a new policy out of a special fund, then conversations I've had with people in and around the Capitol have been that in those cases, those could be majority vote bills in each house. So typically you're either getting your dollars from state special funds or from the general fund, and general fund, you're going to trigger your 2/3 vote requirement.
Thank you. So I'm going to combine a couple of questions here and dig in a little so we can answer more of these. So the main question was an example of why might a legislature pull a bill, but more specifically, what are the common hurdles in appropriations committee or other decision-making points in this process do you find are, like, other than cost, are big reasons why things don't move forward? I know that some of you, or each of you, had given some examples, but is there anything other than cost that really sticks out as hesitancy or pushback or four-year-long issues and getting something moved in? Could you expand on any of those?
Go ahead, Ron. Come on. You're on mute.
Thank you for that. So last year, particularly, we didn't necessarily have bills that were pulled, but there were a number of affordability bills that did move forward, and certainly they all did not get to the finish line and move through the process. With that said, though, I mean, certainly there was a conversation in the budget, and coming out of that conversation, one thing that I think we realized with the affordability discussions last year were particularly that there was a lot of work to do to really understand how to make the mechanisms work. If there was going to be affordability assistance, essentially subsidies to those folks that are already buying coverage within Covered California, what does the mechanism look like to ultimately get that funding, that state funding, to those individuals to help coverage? Is it's something that would flow directly through Covered California? Is it something that would flow directly through the Franchise Tax Board? Certainly there had to be a lot of work to figure that out. So there was a bill, AB 1810, that ultimately did move forward in that discussion, which did create a feasibility work group through Covered California. It did kind of consolidate a lot of what had been happening in that conversation towards those failed efforts to really put us in the place this year to be able to understand more about the types of costs that would be associated for different ways of moving affordability assistance forward, whether it's more on a very big scale or more on a narrow scale, and then also looking at the mechanisms that would need to be in place to actually deliver the assistance to a consumer. So I think, to be very specific and close that out, I think, really sometimes you don't necessarily have a policy that is fully cooked and that could specifically deliver the supports that you're trying to create through the budget process to the communities that are essentially looking for that benefit or support. But there may be times where you have to slow your conversation down, either yourselves or that gets slowed down for you by the legislature, at times through a probe, sometimes with a veto, so that you can get to the place to develop your proposal more. But I think that that's all part of what we're all talking about today, and really trying to figure out what process is best to extract the most information that can advise the strategy that you need to move forward.
I would just add to Ron's points, which I think are excellent. Rarely do I see the Appropriations Committee kind of making a decision to hold a bill for non-fiscal reasons. It really is, they do a pretty decent job in the legislature to kind of say this is a policy bill, it's being heard by a policy committee, and we'll reserve judgment about the cost because that's not our role. And then vice versa on the legislative, on the fiscal side, if there is a policy change that happens to a bill, it gets amended coming out of committee, those policy decisions are based on a fiscal reasoning. And so if you see something get held up in committee, or sometimes you'll see the author pull the bill and or stop the bill at that point, and that might be because it's not cooked, as Ron said. Both we need time to work it out, and also the fiscal committee or the appropriations committee is the last bill before it hits the floor, and so if you get a bad vote on a bill, it could kill both your budget and your bill issue if you're not prepared, if you haven't worked out the kinks. And that's been one of the great things that we've benefited from, actually having a really good bipartisan votes on some of these anti-poverty bills that we've done in the budget. Those votes were really important to advocate in the budget, and because they were bipartisan and strong votes. And the opposite could be true. If you get a bad vote on a bill, then it really does hurt your budget opportunities as well.
And I think one thing for us is the politics, right? If you have an opponent on the proposal, if you're getting a lot of pushback from especially government entities, for us, we oftentimes are asking for funding for people that do the work. And oftentimes, if you can't get the agencies, Department of Social Services or any state agency that you can imagine, to agree with you in your request for additional staffing or additional funding, you're kind of in a stronghold a little bit. You also need to have certainty of funding and have some understanding of what the budget obligation is going to be, not only in the current year, but also in the future year. And I know you said beyond cost, but one thing I want to add on the cost perspective is you have to think about their thoughts on the economic stability of the state in future years. If you know that you're trying to push for a program that has continued years of funding requirements attached to it. So I think you have to play it out 3 and 4 years ahead, see what opponents you're going to have either on your side or against your side. And as I stated earlier, and I know you repeated it, the early starting of this work is what gets the drumbeat going for more people to be pushing for that than not. So I just add that to it.
And also that early start helps to get the actual dollar amounts. The fiscal appropriations staff, they have so much work. They have all the bills coming through their committees, or lots of them coming through their committees, and they rely a lot on the estimates departments of each department, right? And if the department and the staff who work for all the state agencies and state departments haven't been able to put the time behind analyzing the fiscal impact of a certain policy proposal, then it might be that they communicate to the policy or to the appropriation staff that the data is not there. They might communicate that same thing to the budget staff. So that early start is really important, because you will need that participation from the administrators to help identify the costs, both in the coming years and the out years. And you don't want to wait till the last minute to have that information. And if there isn't information available for the committee staff, sometimes they have no choice than to make the bill not move forward.
Thanks. And that actually brings me to, in a lot of these situations, the Budget Center can help, right? Data, research, looking at the whole budget, et cetera. These are things that we do, and getting us early in the process and help figure out ways that we can help contribute to that is something that we, as an organization, strive to help with, right? And that was my shameless plug.
Well, and Tia was, and Ron have been in these rooms where for the beginning, when we started to talk about a policy, hopefully, this campaign, End Childhood Poverty and End Deep Poverty. When we started these conversations with the Brown administration, one of the first questions they had for us on ending childhood deep poverty was, why would we invest in kids who are deeply impoverished when we invest in the kids that are just a little bit impoverished? We could reduce our poverty numbers really quickly. And we recognized really, right away that we had a data problem, because nobody was measuring how many kids were deeply impoverished. And that meant that those kids might get left behind. And I remember stomping is the right term, out of the governor's office and rushing over to talk to the Budget Center and say, could you guys create a list of how many impoverished kids there are? I'd like it by legislative district, please. And it took a little while. This wasn't easy data to find, but they stayed on it, and that research has really informed the legislative conversation about ending childhood deep poverty. And I think we're going to do it very soon. I think California can put a feather in our cap for having achieved that first milestone to ending poverty altogether.
Thanks, Jessica. All right, so you guys talked about these oppositions, and I have advocates asking here, if you're not in the rooms for those conversations, how do you find out what those oppositions are? How do you find out why it got pulled, or whatever the case is? Like, how would somebody just go online and find it out? How are you having these or how do you find that information if you're not in those rooms?
Just to clarify, you're talking about finding information on the opponents?
On the opponents, and also like if it was because of fiscal reasons, how did they find out why it stopped or why it's paused, or how?
Well, for us, and Jessica and Ron, you guys can chime in. I think presence is power, right? And we have people stomping in the halls of the Capitol, even if there's not any business to take care of, just to make sure that you're there. You stay present in the face of the people that are making policy decisions. And it's multifaceted, right? It's not just with the committee that is at the current time looking at the bill, or the chair that at the current time is looking at the bill. It's with the other house. It's with Department of Finance. It's with the Speaker's office and the Pro Tem's office, and creating relationships with as many people as you can. And so you're getting information about things that are happening in closed door rooms. I think all of us experience conversations that are happening and decisions that are made without us being present. The only thing that I believe saves us, and SEIU has probably a stronger position in that we have 700,000 members we can put in the halls of the Capitol to track pretty much everything we need down. But I would just say presence is power, but would defer to Ron and Jess to see what you guys thought.
Yeah, I totally agree with that as well. Presence is power. I think also really identifying the agencies and the people at those agencies that can help think through the policy proposals and the mechanics that you're trying to create. You have to build those relationships. You have to interface with those people. You have to build the coalition of champions within the legislature, as well as you're thinking of the mechanics, and get everybody on board. It really is, when you are creating these programs, that you're not only putting your vision out there, but you're also actively building support around that vision every step of the way as the program mechanics are being built to ensure that it's feasible for the various stakeholders that need to be involved. So it really is, again, not to say this any other way, presence being important, relationships being important, and also just strategic thought about how to build a coalition of supporters, both within the administration and the legislature and the general public.
And I I'm not Pollyanna, but I do choose to believe that if somebody tells me something stopped for fiscal reasons, then I believe that. And I work within that paradigm to figure out what our next steps are. I think because things happen so quickly at the Capitol, and a lot of times with a lot of people really tired and under a lot of stress, I think there's a tendency to be like, what really happened? And try to spend too much time trying to figure that out. If somebody said something stopped because of the budget or because of a policy, or sorry, because of a fiscal concern, then I just take them at their word and we try to work towards policy, either making sure that the policy change is so revered, right? That the status quo is so disgusting that it doesn't matter how much it costs. I tell people that if we can just prove to them, show them how disgusting the status quo is, it won't matter how much it costs. They'll want to change it. And so sometimes that's how you overcome something getting caught fiscally. And sometimes it's just a matter of actually kind of people having a disagreement about what the actual costs are and what the estimates are based on. And if that's the case, then you sit back, come summertime, you come back to the table with the administrators and the fiscal analysts, the LAO, the Legislative Analyst's Office, the Center on Budget. Everybody kind of sits down and tries to figure out what are the real numbers. Can we have a conversation about that? But I tend to not kind of put much more in thinking into who killed my bill and why did they kill it, because you could do that all day and it doesn't really get you that much further. But if you take people kind of at their word, they kill, the bill got killed because of it's too much money, and you work with that, then I find that that's usually the next best step to your victory.
Great. That your guys' answers actually answered quite a few questions that we have here on sort of best practices and the relationship building and being a presence continuously. I have to dig in that a little bit deeper. I have a specific question on how would you like grassroots organizations that want to help in these efforts really get into this work? Like, how would you like them to engage with you all? How would you like them to engage with the legislature? Is it just showing up at hearings, or is it more than that? Is there more roles that they can play in helping with the process?
I know on our end, we try to engage as much as possible, and there's so many different points of engagement. We organize on the ground, right? Whether it's in districts or localities where there's issues that are happening and we want to engage people in the overall process. We, of course, invite, and I think we have a lobby day a week where we have our members coming up to be able to voice where their positions are to legislators directly. I honestly believe that there's no better voice than the voice of the grassroots organizations. They're way better of a voice than any of us lobbyists here in Sacramento. And so I think it's up to us, Ron, Jessica, Scott, all of us, to find the points of engagement for those real voices on the ground. We are part of a Dream Alliance that I know Jessica and Ron are also a part of. It was really this effort to try to bring progressive grassroots organizations together on a monthly basis to talk about different policies that are moving through the legislature that we can help piggyback and help fight with each other. I think that's one voice that we're trying to gather the grassroots perspective in a lot of our conversations. And then I just add that media is a big component. Social media is a big component. Calling legislators on the phone or meeting them in their district office, a huge component. So there's all these different ways that we can ensure engagement. I think we have the following and the capacity and the drumbeat in our communities to do it. And for SEIU, again, we do it through our local engagement at the county side and at the local side, or through our Dream Alliance, or engaging folks in policy directly at the state capitol.
Yeah, I think obviously unions are one of your best grassroots organizing groups out there. That's really what the union model is. So, when Tia comes to town, bringing up an issue, you can bet that they've already had focus groups with their members. They've already had surveys. They've had lots of conversations. I love learning from her members and the members of the other unions who are just normal people organizing around the issues they work on. In addition to those groups, there's also many coalitions throughout the state that deal with kind of certain issue areas. So for example, the California Hunger Action Coalition will bring about 500 to 600 people, about half of them impacted by hunger themselves, at the Capitol every year. We have the Stronger California Coalition, which is a coalition of issues related to women, economic, work, and social. We have, well, the Poor People's Campaign made a presence last year, and we continue to communicate with them and work with them to help identify, kind of lift up policy priorities that are important to that campaign. They actually put out a number of policy platforms that if you haven't seen, I hope you'll go look for them through the California Poor People's Campaign. There's the SSI Coalition, and kind of on and on. And so there's no real like single way to hook in with, for us to hook in with those coalitions, because each coalition is a little bit different. But if somebody were interested in an issue and came to us and said, hey, how do we engage on this issue? We might then be able to direct them to the coalition working at the grassroots level in coordination with us in our policy work. You're on mute. There you go.
Thanks again, Jessica, for letting me know I'm on mute. I would just put in a quick plug for joining the Care for All Coalition that is coordinated by Health Access, or also joining the Health for All Coalition, co-coordinated by Health Access and the California Immigrant Policy Center. Just feel free to reach out to me with my contact information. Happy to plug you in. We work in close coordination also with Jessica from Western Center and also Tia from SEIU. Our makeup is about working with a coalition of groups that certainly are very interested and supportive of the issues facing healthcare consumers. So please do reach out to join those spaces.
One thing I just wanted to add on, and I'm sorry to speak twice on the same question, but piggybacking off of what Jessica said, I think there's a general perspective or maybe a thought that unions are only out representing the grassroots interest of workers. And I just want to make sure, and I'm sure most folks know that for a long time, for years and years before I even became a member of the union movement, unions have been the voice of racial justice and the voice of criminal justice and the voice for healthcare for all, whether you're a worker or somebody that's unemployed. And so when we survey our workers at the beginning of the year, as I indicated in the beginning of my presentation, the priorities that they come out with are not even, I would say, majority of things that are improving their day-to-day life at their job. A lot of the things they're proposing were bail reform, to ensure that their sons and their daughters or their family members that get incarcerated aren't being held because they don't make enough money to get them out. Issues like healthcare for all outside of the work, right? Making sure that immigrants and our brothers and sisters who don't have a job or employer coverage have coverage. And so I would just put that soundbite out there that the grassroots movements of unions is not just about worker focused policies. It's really about policies that advance the progressive movement of California and advance the values of low wage and the underprivileged workforce and members of the state of California overall.
All right, thank you. So we could literally spend all week here talking about different tactics and examples and drawing on the breadth of knowledge of our amazing panelists that have been doing this for a decade or more now. So I want to thank you again, Jess, Ron, Tia, for joining us. And thank you to all of you who had stuck around and for this Policy Perspective speaker series. Again, if you have any further questions or we didn't get time for yours, feel free to always contact us. This is our information on there, and we will connect you with those if we can't answer them for you. And a last plug, later this month will be our annual policy conference, Policy Insights, on March 27th here in Sacramento. And if this is your jam, if you want to know more about policies, whether it's health, whether it's racial equity, whether it's gender equity, criminal justice reform, this is where you go. This is where all you policy people are interested and want to know more. And with that, thank you all again for joining us, and we'll talk to you soon.
Thank you.